It's always good to wake up to a little good news. United Healthcare today had their stock drop by more than it has in 25 years. This was due to them announcing that for some reason their profits dropped by 10% in the months of January to March 2025. This is because they decided to start treating more patients, because the claims were more valid, because doctors gave diagnoses to their patients that needed healthcare treatments and medicines. It's probably just a coincidence that their CEO was murdered last year. And the shareholders are saying, we needed warning. I wonder where the warning is for all of the patients who go to the doctor and wait to get an appointment and sit in the waiting room, maybe with an acute injury in that moment, and then they have to wait, and then they get told by a doctor, you need this treatment because you have this illness or you have this injury and you need this surgery to refix a bone, only to be told later, surprise, surprise, it's not going to be covered. And a lot of times after the treatment is done and they just get the bills and the companies are like, no, we're not going to pay for it. Oh, did a doctor with 4 to 12 years of medical training tell you you needed that treatment to fix your broken leg, or you need that treatment to treat a cancer? Sorry. I have no sympathy for these shareholders. And the fact that United Healthcare just suddenly started accepting more claims, that doesn't do anything for me either. Screw the shareholders in this situation. And they played a game. They're basically like poly market betting on the health of people and their financial fate as far as being able to pay their bills because they ended up with a medical treatment they needed. We need to get rid of all of these companies. They should not exist. United Healthcare, Kaiser, Sutter Health, even like Anthem Blue Cross, because Anthem Blue Cross used to be nonprofit and they had to go profit model because everyone else did. Screw them, get rid of it. Even if we're not number one in the world, we'll still have a lot of wealth in this country. It just depends on how we spend it. In 1948, when London was in crumbling state after World War II, is when they put in their national health system. We can do it too. Let's do it.